Hi, I'm Professor Graeme Yorston, and today I'm going to be discussing the sad story of Rosemary Kennedy, the forgotten sister of John F. Kennedy, who was lobotomised at the age of 23 and forced to spend the rest of her life in an institution away from the family she loved. I'll be exploring the highly emotive question of whether her lobotomy was a genuine attempt to treat mental distress and behavioural difficulties, or simply a way of keeping her quiet and out of the way so that she would not pose a threat to her father's ambitions for his sons.
Rosemary Kennedy was born at her parents' home in Brookline, Massachusetts in September 1918. Her father, Joseph P. Kennedy Sr., at the age of 30, had already made a fortune on the stock market and become friends with Franklin D. Roosevelt. Joe Sr. was a highly driven man with lofty ambitions for his children. Her mother, Rose Fitzgerald Kennedy, had produced two healthy sons, one of whom, John F. Kennedy, would of course go on to become President of the United States, and she would have 6 further children, but Rosemary's birth did not go well. The pregnancy was uneventful, but when she went into labour, the doctor was delayed as he was tending to patients with influenza. Understandably, as 1918 was right at the peak of the great influenza pandemic that killed as many as 100 million people worldwide. Because of the delay, according to her biographer Kate Clifford Larson, the nurse who was with Rose ordered her to keep her legs tightly shut, and when this did not work, the nurse held the baby's head and forced it back into the birth canal for 2 hours, resulting in Rosemary being starved of oxygen.
I have to say, I find this difficult to believe. Obviously, I'm not an obstetrician, but I did deliver 20 or more babies in my training to become a doctor. And this simply does not ring true. I cannot believe any nurse would have done something that would have been so obviously dangerous to mother and baby. It is reference to a nursemaid and governess in the Kennedy household who was not present at the birth. And I wonder if the account has more to do with trying to distance the family from any taint of genetic responsibility for Rosemary's disabilities than providing factual information.
Rosemary's developmental milestones were delayed. She was very quiet, and at 2 years old she was still finding it difficult to sit up and crawl, tasks which are normally achieved by around 12 months. Her mother told her friends that her daughter was developing normally, but she would have known that there was a problem, as she was meticulous in keeping details of all aspects of the children's health on a card index system. When Rosemary's 2 younger sisters were born and began to overtake her, it would have been clear that she had what we would now call an intellectual disability, but at the time was called mental deficiency, divided into 3 grades of severity: idiot, imbecile, and moron or feeble-minded. These terms, although deeply offensive now, were not considered so in the 1920s and 30s, when compulsory sterilisation was carried out in many countries, and there was a serious debate about whether lethal chambers should be established to deal with the problem. A debate which led ultimately to the Nazi T4-Aktion program, which murdered between 200,000 and 300,000 mentally ill and intellectually disabled children and adults during the Second World War. At the age of 5, Rosemary started a public kindergarten in Brookline, as her older brothers had done. However, at the end of the year, her teachers refused to let her progress to 1st grade. Her mother responded by seeking medical and psychological opinions in Harvard and Washington, all of whom agreed she was retarded. Her IQ was measured using the Otis Intelligence Test, a modified version of which is still in use today. We do not know her score, but her mother was told it was low. She did move up to 1st grade after repeating a year, but she then had to repeat that year as well. In 1927, the family moved to Riverdale, 10 miles north of Manhattan. The Kennedy children attended a prestigious private school, Rosemary starting in 2nd grade alongside her younger sister. However, she struggled with basic literacy and maths, finding it difficult to shape letters and spell, and her sentences were often incomplete. Her parents arranged private lessons and tutors to help, but she could not keep up, so she was taken out of school and taught at home. She was also uncoordinated and lagged behind her siblings in sport. She was described as heavy on her feet when dancing, and she could not cut up meat on her plate. Her sister Eunice believed she may also have had seizures, as she recalled doctors being urgently summoned to the house to administer injections while the other children were whisked away. Her mother later said she wondered if she had neglected her other children because she gave so much attention to Rosemary in an effort to circumvent her affliction. However, her diary entries actually contain few references to Rosemary. In 1929, the family moved to Bronxville, but the 11-year-old Rosemary was sent to a specialist boarding school in Pennsylvania for the intellectually disabled. Rosemary settled in, but she had low self-esteem and had outbursts of impatience, or what we would now call meltdowns. At age 15, Rosemary was moved to a convent school near Providence, Rhode Island. Her social skills were good, but her literacy and numeracy did not progress beyond the level of a 9 or 10-year-old. The following year she was moved to yet another school, but this one was back in Brookline, closer to her family, and closer to her eldest brother Joe Jr., who was a freshman at Harvard. Joe Jr. took her out and wrote that some of his friends had met her and thought she was nice. Interestingly, Joe Jr. spent a year in Europe before Harvard and wrote to his father about Hitler and his sterilization policy for the intellectually disabled and mentally ill, saying, "It's a great thing. I don't know how the church feels about it, but it will do away with many of the disgusting specimens of men which inhabit this earth." Rosemary wrote to her parents often, reassuring them that she was working hard, but also telling them about her outings and social events and what she was wearing. She particularly wanted to please her father. While at the school, she saw a Dr. Charles Lawrence, an endocrinologist, who gave her injections and red pills. The pills may have been phenobarbital or luminal, a barbiturate which was widely used as a sedative and anti-epileptic. And the 3 times weekly injections were probably anchuitrin S, an extract of the urine of pregnant women containing a mixture of sex hormones that Lawrence was using to treat a variety of conditions, including acne. Her doctors reported that she improved greatly on this regime, and her father thought so too, after seeing her on a visit. But her mother continued to seek advice from specialists on how to get her better. She called in Dr. Walter Dearborn, a pioneering educational psychologist at Harvard, to advise on Rosemary, but his recommendations were to no avail. In 1936, now aged 18, she was moved to another school in Manhattan. The following summer, she was taken on a tour of Europe with a companion who described her as daydreaming a lot. It is possible that she was not daydreaming at all, but actually having absence seizures, or what used to be called petit mal epilepsy, which are often mistaken for daydreaming. On her return, the school declined to have her back, and she was sent to the Sacred Heart Convent Academy in Manhattanville instead. In January 1938, her father was made United States Ambassador to the United Kingdom. Joe Sr. left first, followed later by his wife and the younger children. Rosemary, meantime, spent 3 weeks in a hospital in Boston. Press releases suggested that she was there merely for a checkup. If so, it would have been the longest checkup in medical history. And there has been speculation that she was actually suffering from acute anxiety about the move to London. The family moved into the ambassador's residence on Grosvenor Square in Mayfair, just about the poshest area of London. Rosemary and her sister Kathleen, or Kick, were presented as debutantes to King George VI and Queen Elizabeth at Buckingham Palace, only 2 weeks after her arrival in the country. All seemed to be going well until she tripped and stumbled, but she was able to gather herself, and she curtsied in the prescribed way, and then danced the night away with the eligible bachelors of Europe. The British press was enchanted, especially with Rosemary, but it was her younger sister who was allowed to enjoy life in pre-war London, jaunting around freely with the upper echelons of society, much to the frustration of Rosemary, who was heavily chaperoned. Rosemary was sent to a finishing school for young women, but this didn't last long, and she was quickly moved to the convent of the Assumption School in Kensington Square, which had just adopted the gentle teaching methods of Dr. Maria Montessori. In this environment, Rosemary flourished. Everyone said how happy she was and how well she was. But then war broke out in Europe. The family returned to the US, but Rosemary stayed on at the school, which relocated to Hertfordshire to get away from the Nazi bombing of London. This was probably the happiest period of her life. She was not put under any pressure to do things she could not achieve, and she was given a role, a purpose, something to do, something that she could be proud of. The sister in charge wrote to her parents saying, "She has some supervision of the children in the garden. She also has a stated time for reading to them. She prepares and gives them the lunch in the middle of the morning, and she has many other occupations of a domestic kind, which she is able to do alone, not the least of which is putting away the china and silver in the cupboard." But sadly, this contentment wasn't to last. Her father was worried about the threat of German invasion. He did not rate Britain's chances of defeating Hitler, and even though Rosemary pleaded to be allowed to stay, she was flown back to the US on the 1st of June 1940, as British forces were being evacuated from Dunkirk and Hitler's troops were marching inexorably towards Paris. Rosemary went back to the house in Bronxville that she hardly knew and started the summer in Hyannis with her fiercely competitive siblings, socializing, talking politics, playing games and racing boats. She went out, but she could only dance with her brothers and their friends, and she was carefully watched over by her younger sisters. A close friend of the family noticed her frustration at not being able to compete on equal terms and commented that she was aggressively unhappy. Every day she would lash out with anger, exhaustion and frustration. One of her sisters said that she would have tantrums or rages, break things and hit and bruise people. She also had convulsions. Some commentators have suggested that these were psychogenic seizures, or what used to be called pseudo-seizures, non-epileptic attacks brought on by emotion and stress. But it seems to me that they are just as likely to have been full epileptic attacks. Another friend of the family said, "It was embarrassing to be around Rosemary. She would behave in strange ways at the table. She would appear there standing in her nightgown when everyone else was moving ahead so rapidly." Another friend said, "Rosemary's customary good nature has given way to tantrums, rages and violent behaviour. Pacing up and down the halls of her home, she was like a wild animal, given to screaming, cursing and thrashing out at anyone who tried to thwart her will. For no apparent reason, she would erupt in an inexplicable fury, the rage pouring out of her like a tempest from a cloudless sky. On one occasion, she suddenly attacked Honey Fitz, her 78-year-old grandfather, sitting on the porch, hitting and kicking him until she was pulled away. Something had to be done. Bizarrely, her mother sent her to a summer camp. Rosemary was delighted. She thought she was going to be a junior counsellor, and she wrote excitedly to her father about this on the 4th of July, still desperate for him to be proud of her. In fact, her mother had asked for her to have one-to-one supervision at all times, even though she omitted to tell the organisers about her behaviour. After 3 weeks, the organisers had had enough and asked for her to be removed. Her unconcerned mother, however, refused to collect her, and so the camp organisers had to take her back to New York themselves. This is the poignant letter she wrote after she left, full of longing for someone to stay in touch as she arrived at yet another new school. This one was in Germantown, Philadelphia, where incidentally Grace Kelly was also a pupil. It claimed to be familiar with the Montessori teaching style, but it did not suit her, and it is said that she went into such a decline that there were plans to admit her to a nearby sanatorium. However, instead of a hospital, she was sent to St. Gertrude's School of Arts and Crafts in Washington, D.C. for children with intellectual disability, established in 1926 by Thomas Werner Moore, a pioneering psychologist, psychiatrist and monk. This was to be her last school.
Rosemary's unpredictable outbursts of rage became more frequent, and she defied the nuns. She began sneaking out at night and was found wandering the streets at 2 o'clock in the morning, often in a dishevelled state, and her explanations of what had happened really made no sense at all. The nuns thought she might be getting involved with men, and that she could end up getting pregnant or contracting a sexually transmitted disease. Well, the nuns may have been right, of course, but as far as I'm aware, no one has considered the possibility that she might actually have been experiencing sleepwalking and what are known as confusional arousals. These are disorders of deep, slow-wave sleep that typically occur in the early part of the night and which are known to be more common in people with learning disability.
Around this time, her father was obliged to resign from his role as ambassador to the UK because of his anti-British and anti-Semitic comments, forcing him to refocus his political ambitions on his sons. Meanwhile, Rosemary's behaviour was getting increasingly difficult to manage in the convent school. In May 1941, a newspaper article reported a revolutionary new brain operation being carried out by 2 doctors at George Washington University, Walter Freeman, a neurologist, and James Watts, a brain surgeon. The article declared that many patients who underwent the procedure were transformed from being problems to their family and nuisances to themselves into useful members of society. In August 1941, the Journal of the American Medical Association published a panel discussion between Freeman and doctors from other states who were experimenting with the procedure. Freeman himself admitted that, based on his experience of 80 cases, and amongst many other complications, the personality of patients was bleached by lobotomy. Bleached? What a damning description of his own work. If only he had paused and listened to the voices of those advising caution. But he did not. Walter Freeman was on a mission. There must have been some discussion about the operation within the family, as Rosemary's sister, Kick, who was working for a Washington newspaper at the time, spoke to a fellow reporter who said that he had seen for himself that the results of the surgery were not good. Patients don't worry as much, but they're gone as a person, just gone.
We don't have a clear understanding of what they were hoping to achieve with the lobotomy in Rosemary's case. Freeman himself wrote about it reducing the distress of people tortured by the delusions of schizophrenia and involutional melancholia or the severe depression encountered in menopausal women. But Rosemary was 23 and way too young for that. And there is nothing that I have read that points to her having schizophrenia.
Dr. Bertram Brown, a former director of the National Institute of Mental Health, had access to family records and concluded that Rosemary was mentally ill and not intellectually disabled at all, as she could do complex mathematical calculations. Dr. Watts, who carried out the lobotomy, also believed she was depressed.
My view is that intellectual disability is a much broader concept encompassing impairments in social functioning, language and communication, behaviour and understanding, as well as specific cognitive abilities such as arithmetic. I believe the evidence does point towards Rosemary having a mild intellectual disability, possibly complicated by epilepsy and a sleep disorder. It does seem, however, that something changed after her return from England. The temper outbursts got worse and became more frequent and unprovoked. This may have been a depressive illness or simply an adjustment reaction to having been pulled out of a calm and undemanding environment where she was happy and had purpose, and returned to the high-octane family where her lack of achievement was obvious to all, and when that didn't work, being thrust into yet another Catholic school where she was not understood and they could not meet her needs.
We don't know if there was any discussion about the alternative treatments that were available at this time, including psychological therapy, hydrotherapy, metrazole shock treatment, electroshock treatment, and insulin coma therapy. Most of these were also pretty ghastly, it has to be said, but not as bad as a lobotomy. There were no specific treatments for depression. Amphetamines were being tried, without any success, so morphine was still being used. There were a number of sedatives and tranquilizers, however, including barbiturates, chloral hydrate, potassium bromide, and hyoscine, which were effective at calming agitation and helping sleep.
We simply don't know if any of these were considered or tried. We just know that her father decided to go ahead with the lobotomy, and Rosemary was operated on sometime in November 1941.
The procedure was terrifyingly simple. Rosemary would have been conscious and given a local anaesthetic to the scalp. She would have been strapped to the table to stop her reacting to the rattling of instruments, the noise of the suction apparatus, and the spark of the electric cautery. Her head would have been shaved to the top of her skull, and surgical incisions made in the skin. Dr. Watts would then have drilled through her skull, which she would have felt, and then pushed a long, blunt knife or leucotome into her brain, and then swept it from side to side, going deeper with each arc. She was asked to talk, count, recite the months, and sing God Bless America, all of which she did, until the final sweep, when things went disastrously wrong. She went silent, and she stayed silent for a long, long time.
Her abilities were reduced to those of a 2-year-old. She could no longer walk or talk. She was incontinent and needed full nursing care. After months of physical therapy and speech therapy and very hard work by Rosemary herself, she was able to move around and speak a few words. However, she never gained the full use of her hands, and she always needed help with walking.
It seems likely that one of her cerebral arteries was damaged, causing a sudden bleed, resulting in a stroke or hemiplegia, with paralysis of one side of her body and damage to the speech areas of the brain. This risk was acknowledged by Freeman, who admitted that 2 of his 80 patients suffered a hemiplegia. But it is what happened next that is perhaps even more shocking. Her father had her whisked off to an institution, at first to Craig House, an exclusive psychiatric hospital 90 minutes north of New York City, and a few years later to one 1,000 miles away, the St. Coletta School for Exceptional Children in Jefferson, Wisconsin, where she spent the rest of her life. Her father had a private house built for her about a mile from the main campus, but her parents did not visit her, and none of her siblings knew of her whereabouts for the next 20 years. Her mother made no mention of her in her frequent and lengthy letters to the other children. It was as if she didn't exist. 2 nuns provided her care, and she had ceramic sessions 3 nights a week, a dog that went with her on walks, and a car to take her out for rides. She was luckier than many whose lives were destroyed by the procedure, and she did not want for things that could be bought. The family explained away her absence by claiming that she was reclusive. But in 1962, after their brother was elected president, Eunice wrote an article about Rosemary's intellectual disability. But it was only after Joe Sr. had a stroke that left him unable to walk or speak and exert his control over the family that Rosemary's siblings were made aware of her location. When he died in 1969, Rosemary was gradually reincorporated into family life. She visited relatives in Florida, Washington, D.C., and her childhood home on Cape Cod. She died from natural causes in January 2005 at the age of 86, with her sisters Jean, Eunice, and Patricia, and her brother Ted by her side. And she was buried beside her parents in Brookline, Massachusetts.
So, was Rosemary Kennedy's lobotomy a genuine attempt to treat her mental distress and behavioural difficulties, or simply a way of keeping her quiet and out of the way to avoid damaging the Kennedy family's reputation? Well, my view is that it was probably a bit of both. I'm not in any way trying to gloss over the wrong that was done to her, but I can believe that her family would have been extremely worried about her and keen to explore whatever new medical ideas came along, however improbable they may have sounded.
The bigger villain in all this, I feel, was Walter Freeman. described by Jack L. High in his book as the most scorned physician of the 20th century, behind Nazi doctor Joseph Mengele. Strong words, but appropriate for a man who went on to perform 4,000 lobotomies on adults and children as young as 4, many long after the introduction of effective medication in the early 1950s. Never wearing gloves or a mask, but always ready to smile for the cameras. His messianic promotion of the lobotomy procedure, particularly in his modified ice pick version, led to over 40,000 people being treated in this way in the United States alone. It has featured in countless books, plays, and films, almost always perpetrated by an evil psychiatrist in a darkly oppressive asylum, even though Freeman was actually a neurologist and the public mental hospital in Washington, D.C. did not allow him to carry out his work on their premises. If any good can be said to have come from this sad story, it is that her brother John initiated legislation designed to improve the quality of life for Americans with disabilities, and other members of the family have continued to be involved in this movement, her sister Eunice in particular. There is still a long way to go, of course, but progress has been made, and Rosemary's story is becoming better known and being used to remind the world of the dangers of trying to hide away uncomfortable issues and marginalise those regarded as different.
Thank you for watching. I hope you have found this video interesting, and I look forward to seeing you again soon. Bye for now.